So the ACL will provide about the 85% of the total passive resistance to the anterior translation of the tibia, and the ability of the quadriceps to train the ACL is at the greatest or at the near full extension from 15 to 0 degrees of extension. The quadriceps muscle is referred to as an antagonist, and hamstring is referred to an agonist. Okay, so here I want to say something important about the hamstring thing. The person, when you see some person with an ACL deficient knee, that is when the ACL is deficient due to some injury or something, they usually try to go with some amount of external rotation. Okay, I'll say why the external rotation is happening in the coming slide. So, but the studies have shown that when there is an ACL injury or when there is an ACL deficient knee, the subjects will try to go for excessive external rotation. That is why, because of the excessive activity of the biceps femoris and the vastus lateralis is happening. So when the ACL is getting injured, the lateral part of the muscles, like mainly the biceps femoris and vastus lateralis, is taking more dominant when compared to the semitendinosus, and that is taking a portion of more of external rotation. Okay, and why that is happening, what will happen, and all I will come in the next slide. Okay, so if you see a tibia external rotation following a ACL thing, then that can be due to the excessive activity of the biceps femoris and vastus lateralis and compared to the semitendinosus. This is one of the common finding happened to the ACL deficient knee subjects. Okay, so why this is happening? If you see this, as I mentioned in the previous slide, the ACL is not a straight ligament. It attaches from the tibia and it goes posterior, superior, and laterally, and it is attaching in the oblique thing. And so, due to that oblique orientation of the tibia, that is having some role on the tibia internal and the external rotation when we talk in relation of femur. Okay. So the tibial internal rotation will elongate the ACL. So if you see this picture, so what is happening in this picture is this is the thing how the ACL will go from attachment here to the medial side of the lateral femoral condyle. So what will happen during this internal rotation? You assume there is something attached from here to here, okay, and when you try to do an internal rotation, that will try to elongate further or it will stress the ligament more. If you see, when it goes for the external rotation, the ligament is slackened or it is going to, or it's not in a position to take much of the load of the anterior translation. So when you see why we term it as an secondary restraint, as it goes for more rotation, mainly in the extended position, this will try to prevent something to go further. The resistance will place and that will take some tensile load and it will try to stop preventing the loading. So it is a secondary restraint to the internal rotation. And as it goes for the external rotation, the ligament will be in a slackening or it won't take much load. So what happened when the ACL injuries, injuries happen. So why that is going for external rotation? The ligament is not ready to take any load further. Okay, because already that is in a injured level. That may it's not ready to take the stresses on the ACL. So what will happen as the ligament is not taking much load? The activity of the biceps femoris and the vastus lateralis also will try to act with the thing, and that will try to make the tibia more and more into the external rotation. And as this goes, the ligament is not functioning properly. This side, lateral muscles are taking more load and the medial side will become. So this is one of the common finding what we observe in the ACL deficient knee, because the ligament is not in a normal thing that may go for external rotation with increased activity of the biceps femoris and the vastus lateralis, and there will be weakness of the semitendinosus. This is one of the common finding. So again, I'll just tell, when the ACL is twisted and stretched, when the tibia is in internal rotated position when compared to the femur, the ACL is unwound and becomes slack during the unloaded portion, and tibia is rotated externally in relation to the femur. The slacks and unload, it's more common following an injury. Clear with this? So I think I can go further. The injury is common during the ACL when there is sudden stresses to the knee joint when the tibia is in contact with the ground. The ACL is torn in non-contact deceleration situation that produce the valgus load and internal rotation movement, and on the knee when it begins to flex from the near extension. So this is the common mechanism. Also usually occurs in the high risk pivoting sports when the athlete lands on the leg and start rotating to the opposite direction. Okay, so if you see this picture, he is landing, and usually there is a twisting is happened in the hyperextended knee, landing from the jump shot. Okay, so this mechanism will most commonly lead to the thing, and 70% of the ACL injury will happen in the non-contact sport. Only 30% of the ACL injury is reported in the contact sport. So what will happen in the ACL during deceleration or the acceleration motion? There is excessive quadriceps contraction. Okay, that will try to produce, as is shown in the previous picture, the quadriceps contraction will try to excessively anterior translate the thing, and again there will be some reduction in the co-contraction of the hamstrings or the posterior thing. Okay, so the posterior side is not working properly. There will be excessive quadriceps contraction with some amount of tibia internal rotation or some dynamic valgus. This may lead to ACL injury because the ACL is a primary restraint with this anterior translation. Quadriceps will producing excessive anterior translation, and also it's a secondary restraint to the internal rotation, and the hamstring co-contraction activity is less. This may lead to injury. So all these factors will be correlated to produce an injury. The ACL loading with the more knee extension happen with internal rotation and excessive valgus force also during the weight bearing deceleration activities. And also I just want to do, because why I took this anterolateral ligament, because there are some controversies. They are telling there is no ligament which is existing called anterolateral ligament. It is a part of the anterior capsule. Okay, but studies have shown that the anterior capsule, yeah, it is an extension of the anterior capsule, the anterolateral ligament. Okay, it attaches with the lateral meniscus and the anterolateral aspect of the tibia, and also it attaches in between the gradis tubercle and the head of the fibula, in between the gradis tubercle and the head of the fibula. So here they say that some orientation and it has so many layers. Okay, why this thing is important? Okay, why this thing is important? If you see, the ACL is a secondary restraint to internal rotation when it is in full extension. Okay, as the knee started flexing more from extension to flexion, this structures will act as a primary restraint and along with the iliotibial band. As it goes for more and more amount of flexion, this lateral rotation is taken care by the strong structures of the iliotibial band and the anterolateral ligament. So maybe that is one of the reason why with the internal rotation with the high flexion angles, these injuries are not more common in ACL when compared to the 0 degrees of extension. At 0 degrees, yeah, this may have a role of preventing the rotational movement, but it's not that much as it goes for the flexion. So this anterolateral ligament is a structure along with the ITB. As it goes for more and more flexion, that takes more restraint as a internal rotation, which further reduces the load on the ACL. Even the quadriceps is trying to take the anterior rotation, the internal rotation torque is reducing, and it's not giving much strain along with the hamstrings. So hamstring is trying to prevent one side, this force is taken from this thing. So the maximum injuries is not happening at the further levels of the thing. Maybe this could be a hypothesis why that thing is more common at the 0 degrees of extension when this ligament and hamstring co-contraction is not working properly.